Now coming to treatment. First, certain general guidelines. I told you about asymptomatic hyperuricemia. We do not intervene unless the uric acid level is more than or equal to 10 in females and more than or equal to 12 in males. Then, in case of acute attack, you should never manipulate uric acid levels. Then, while treating secondary gouty arthritis, don't forget to treat underlying disorder also. Then, the treatment of pseudo gout is same as that of appetite. This is about the general guidelines. Now coming to medications that are used in gout. For acute attack, these are drugs that are mainly used. NSAIDs, glucocorticoids, colchicine, these are mainly 3 drugs that are used in a case of acute attack. Now going in more details, NSAIDs. The drug that usually we prefer is indomethacin, and the dose is 50 milligram TDS into 2 days, and thereafter you will decrease the dose to 25 milligram TDS into 3 to 7 days. In case of glucocorticoids, they are given if there is NSAID response is not that much good, or you want a dramatic relief. For dramatic relief, you have to first aspirate the joint fluid, and then you have to give intra-articular injection of steroid. For those who are not getting adequate relief on NSAID, you can give oral prednisolone (40 milligram) daily, and once you have adequate response, then taper it rapidly. Now coming to colchicine. This is given when you don't have any response to NSAID and steroids. If you don't have any response to NSAIDs and steroids, then only we prefer colchicine. And please remember, before giving that, colchicine should be given with cautiousness in patients having liver disease and kidney disease, as it can cause hepatic injury and renal injury, and it is most effective in first 12 to 24 hours. and the dose is 1.2 milligram at onset of symptoms, and then give 0.6 milligram after 1 hour of taking 1.2 milligram. Now discussing about treatment of chronic gout. For treatment of chronic gout, we will do colchicine. We will advise the patient to have decreased weight, and we will also give certain urate lowering drugs. Now about few words about colchicine. I told you colchicine has a side effect of damaging your liver and kidney disease. Okay, so the usual dose is 0.6 milligram OD, or you can even give BD in normal patients, and those having renal disease, the dose becomes 0.6 milligram every third day. Okay, and also you will advise the patients to avoid the following, which includes aspirin, diuretic, alcohol, and the food having high purine quantities like liver, kidney, sardine, shellfish, and sweet bread. Then coming to urate lowering therapy. Certain important general rules for giving urate lowering therapy. The indications for urate lowering therapy are two. Either there is a damage to your joints or kidney, that is urate nephropathy, or there are very frequent attacks, then only we will consider giving urate lowering therapy. And also, before giving these drugs, you have to give colchicine for few days and stop depending upon two conditions. If the patient is having toffee, you stop it only 6 months after revolution, and in case of patients that have without toffee, you stop it 6 months after there is no acute attack or the uric acid level is normal. So these are the general rules. Now going to individual drugs. The most important is allopurinol. The starting dose is 100 milligram per day. You can increase in 100 milligram per 2 to 4 weeks to obtain adequate response. However, please remember, in case of patients having renal or liver involvement, you have to decrease the dose. Okay, and those patients having creatinine clearance less than 20 ml per minute, you have to give 100 milligram every third day. And those who have creatinine clearance more than 20 ml per minute but less than normal value, there you have to reduce the dose by 50 milligram for each 20 ml per minute decrease from normal value. And there are also various side effects for allopurinol. The side effects include hypersensitivity, renal injury, and this is especially precipitated in those who are already having mild renal disease and those patients who are taking diuretics. Then it can also damage your liver, hepatic injury, and then please remember this allopurinol can potentiate the action of certain drugs including oral anticoagulants and certain cytotoxic drugs. The example of cytotoxic drugs include azathioprine, 6-mercaptopurine.